Hi friends, this is Parvati from OPRA KAPS Exam. Welcome to my channel. I need your support, so please subscribe, share and like my videos. Also, you can mention your valuable comments in the comment box. Today we are discussing here the Recalls July 2024. This is the first video for the July Recalls 2024. And I try to include it here, mainly the recalls, whatever we collected from the students and some other sources. And also I try to include the answers. Okay, whatever the questions based important points, because we don't know what is the accurate question. Just we are getting the sources, like this drug they asked in the question, and from this portion they asked the question, like that we are getting. So what are the important points relating that one, and some questions we know the specific answer, that's also I included here. Okay, okay, we can start the video. The first question is drug of choice for acute gout. We know acute gout and chronic gout also there. The treatment, the drug of choice for the acute gout, the first line treatment is colchicine, everybody know. If that's not effective or suitable, the next option is NSAIDs, like ibuprofen, one of the example for NSAIDs. And if needed, we can also use the corticosteroids. This is the treatment plan drugs for the acute gout. And I also mentioned here the chronic gout, just for recollecting everything. Xanthine oxidase inhibitors, example, allopurinol and febuxostat. Also, we can use the uricosuric agents, probenecid. Okay. The second question, which antidepressants are safe in pregnancy? Paroxetine, that is selective serotonin reuptake inhibitors. Nortriptyline, that is tricyclic antidepressant. Doxepin, also tricyclic antidepressant. Duloxetine is serotonin reuptake inhibitors. Okay. The answer is nortriptyline. That is considered relatively safe for use during pregnancy. Paroxetine is generally avoided due to the potential risks. Okay. In the next slide, I also describe some points. Mostly the antidepressant safe in pregnancy, tricyclic antidepressant and selective serotonin reuptake inhibitors. Two tricyclic antidepressants that are generally considered safe for use during pregnancy are desipramine and nortriptyline. In this question, the most accurate answer is nortriptyline, so that's why we selected that one. Okay. Some of the commonly used selective serotonin reuptake inhibitors included sertraline, often preferred due to its relatively favorable safety profile, and fluoxetine, that is used with caution, especially in the first trimester. Okay, in the first trimester, with the caution, we can use the fluoxetine. Citalopram considered relatively safe but should be used under the medical supervision. And escitalopram, it's similar to citalopram. It's generally considered safe but requires careful monitoring. These are the main antidepressants safe in pregnancy. Okay. The next question, serotonin effect of dexamethasone is less with. The question actually it's not clear, but they mention like this also, choose drug not cause serotonin syndrome. The important point relating this one, the drug that reduces the serotonin effect of dexamethasone, I think not the dexamethasone, it's maybe the chance to dexamethasone. Okay. The effect of dexamethasone and does not cause serotonin syndrome is ondansetron. It's a serotonin antagonist, which means it blocks serotonin receptors and helps prevent nausea and vomiting without triggering the serotonin syndrome. So that's why we can choose the drug like ondansetron. Okay. Actually, the question is also not clear, but relating this one, this is the important point we want to know about this one. Okay. The fourth question is percentage of cross sensitivity of cephalosporins receiving population allergic to penicillin. Options mainly they are given in the percentage ways, 1 to 4%, 6 to 10%, 20 to 30%. Answer is, the correct answer is 1 to 4%. Most important question. Anyway, it should be there. Okay. And the next question is, which is not used as preventive in acute exacerbation of asthma. Options are formoterol, salbutamol, budesonide, theophylline. Answer is formoterol. The reason is formoterol is a long-acting beta agonist, that is LABA, used for maintenance treatment in asthma. These are mainly using for the maintenance treatment, not for the acute exacerbations. For acute exacerbations, short-acting beta agonists like salbutamol and anti-inflammatory medications like budesonide and theophylline are typically used. So the answer is formoterol. It's not used for the preventive acute exacerbation of asthma. Okay. The next question is, volume of distribution is decreased in which condition? First option is increased plasma protein binding with no change in tissue binding, decreased plasma protein binding, hepatic failure, and renal failure. These are the options. The correct answer is increased plasma protein binding with no change in tissue binding. When a drug has increased plasma protein binding, it remains more confined to the vascular compartment, that is leading to a decreased volume of distribution. Okay. And the other related, the same portions related one more question is, the volume of distribution is most affected by decrease in plasma protein binding and not change in tissue, increase in tissue binding with same plasma binding, hepatic and renal. These are the options. When a drug binds more extensively to tissues, its distribution volume increases. The reason is it is more widely distributed throughout the body. The main point is relating this one. Volume of distribution decrease when tissue binding decreases or when protein binding increase. This is very, very important point. Please thorough with this point. Volume of distribution decrease when tissue binding decrease or when protein binding increase. Volume of distribution decreases when tissue binding decreases because the drug is less distributed into the tissues and stays more in the bloodstream. Similarly, the volume of distribution is also decreases when plasma protein binding increase, since more of the drug remains in the vascular compartment attached to proteins rather than being distributed into the tissues. The main important point we want to thorough in this portion, volume of distribution decrease when tissue binding decrease or when protein binding increase. The reason is I described here. Just read it, that one also, you can understand everything. Okay. That is also very important question. Please note that one. Okay. And penicillin, the next question is penicillin anaphylaxis history after valve surgery, best option after oral procedure. Cefalexin, ciprofloxacin and metronidazole. If they already mentioned like this one also in that file, if clindamycin there, choose that one, the option. Okay, if in the option clindamycin is there, you want to choose it, that one, or otherwise we can choose the metronidazole. Okay, given a history of penicillin anaphylaxis, the anaphylaxis we know it's a highly allergic reaction. Okay, it's a history of penicillin anaphylaxis. The best option for antibiotic prophylaxis after an oral procedure would be clindamycin. That is the first option. It's suitable alternative for patients with a penicillin allergy. If the patient have the penicillin allergy, we can use the clindamycin. Okay. The next question is antihypertensive used in depression. The previous question is very, very important point also. Okay. The next question, again I am repeating, antihypertensives used in depression. Any drug except methyl dopa. Actually, in the option methyl dopa is there, so that's why they mentioned like that. And we can use the clonidine, beta blockers, calcium channel blockers, and AC inhibitors. Okay, this we can use, but methyl dopa it's not using. I think the question is maybe accepting one. Okay, mainly the description I mentioned in the second slide. Some antihypertensive medications have been found to have a lower association with depression and in some cases may even reduce the risk of depression. Okay, mainly these include angiotensin 2 receptor blockers, ARBs. Examples are enalapril and ramipril, calcium channel blockers, amlodipine and verapamil, Beta blockers, propranolol, atenolol, bisoprolol, carvedilol. Methyl dopa it's not used in this case. In generally not preferred as an antihypertensive in patients with depression. Okay, due to its potential to exacerbate the depressive symptoms, it's increase the symptoms of this one because the methyl dopa it's a centrally acting alpha to adrenergic agonists, so that's why it's not used in the in this case. Okay, the next question we are discussing here, what is filgrastim? Filgrastim, what is the use of filgrastim? The filgrastim is a medication, it's a protein and it's used to treat the neutropenia. Neutropenia, it's a condition, low white blood cell count, it's decreasing. That condition is called neutropenia. So the filgrastim is used to treat the neutropenia. And it's a synthetic, the question is, this is the answer. What is the filgrastim? Filgrastim is a synthetic form of naturally occurring protein. It's also called granulocyte colony stimulating factor GCF2. Okay. Filgrastim, the one more point I mentioned here, filgrastim stimulates the bone marrow to produce more white blood cells, which helps the body fight infection. Okay. So that's why it's used to treat the neutropenia. Okay. The next one is LMWH and heparin comparison related, low molecular weight heparin and unfractionated heparin. That comparison we want to know it. Accurate question, what is the question they didn't mention in that file, but they mentioned like relating the comparison, they asked the question. So some of the points I included here. Low molecular weight heparin is often preferred due to its ease of use, lower risk of heparin-induced thrombocytopenia, and more predictable pharmacokinetics. However, the unfractionated heparin may be used in situations where rapid anticoagulation is needed or in patients with several renal impairment. In that case, we are more preferring the unfractionated heparin. Otherwise, the low molecular weight heparin is often, that is mostly preferred. Okay. In the second slide, I mentioned main comparisons regarding whatever we want to know about the important points for the comparison for the low molecular weight heparin and fractionated heparin. The first point is administration of low molecular weight heparin is subcutaneous and it's given by OD once daily. Okay. And monitoring, it's minimal monitoring only required for the low molecular weight heparin. The risk is lower risk only showing this one. And mainly it's contraindicated in patients with severe renal failure. Okay. Unfractionated heparin, mainly it's giving by intravenous or subcutaneous. Multiple times daily we can give this one. And mainly it requires the regular monitoring of activated partial thromboplastin time. Okay, that means the regular monitoring is required for unfractionated heparin. And it's showing the higher risk. Unfractionated heparin is safe in renal failure patients. This is one of the important points regarding the unfractionated heparin. And the other important point is both we can use in the pregnancy, during pregnancy. However, the low molecular weight heparin is more preferable. The main reason is its better safety profile and fewer side effects. These are the main important points regarding the comparison of low molecular weight heparin and unfractionated heparin. Okay. The next question we are discussing here, actually in that file they mentioned like questions regarding methotrexate. Regarding methotrexate, one of the important point we can expect the question based on their mechanism of action. Mainly the methotrexate we can giving by oral, IV and IM. But in the oral, lower dose only we can give in the orally. Okay. And the main important point is mechanism of action. The methotrexate, it interferes with the DNA synthesis. How it's by inhibiting the enzyme dihydrofolate reductase. This enzyme which is involved in the folic acid synthesis. This point is very, very important. We can expect question based on this one also. Okay. The main uses of the methotrexate, it's various conditions we can use this one, including severe psoriasis, rheumatoid arthritis, and certain type of cancer like breast, lung, and lymphomas. Okay. And Crohn's disease also it's used. Okay. The serious side effects included mainly liver, lung, and kidney toxicity. In pregnancy, methotrexate is contraindicated. and it can cause the birth defects and fetal death. Okay, and it's also may be used in certain cancer treatments during pregnancy under strict medical supervision. Okay, these are the important points we want to know about the methotrexate. Very important point is mechanism of action. Okay, the next question we are discussing here: why pralidoxim is given along atropine in organophosphates poisoning? The main reason is atropine, it reduces the overstimulation of the nerve system caused by organophosphates, while the pralidoxim, it reactivates the enzyme acetylcholinesterase. This enzyme which helps to break down the acetylcholine, and this helps to restore the normal nerve function and reduce the symptoms of poisoning. Because of that, using the pralidoxim along with the atropine in organophosphate poisoning. Okay, these are the only questions I included here. If it's okay, you can comment in the comment section. Like this, we want to prepare the recalls. When you are studying the recalls, that time we want to studying like this. The main important questions regarding the drug, that's also you want to prepare it. It will helpful in the end of the preparation. Not only that question, if whatever the recalls they mention, not only that question only you are not studying, you want to include that relating other points also. Okay, if like that, if you are preparing, it's very helpful for in the end of the preparation. Okay, today I'm just wind up. Thank you.